Did you know that Portuguese healthcare is ranked number 12 by the World Health Organization in terms of overall performance? For example, Canada is number 30, the United States is 37, and Russia is 137. Not only that, Portugal has one of the highest life expectancies in Europe and the world as well. And you might have guessed it right. In today's video, we're going to be talking about healthcare in Portugal. Why do people choose Portugal for medical tourism? How different are Portuguese hospitals from Canadian hospitals? Whether you're planning to move to Portugal or just curious to see how things work in Europe, well, this video was made for you. And without further ado, let's get started. First, let's take a look at how the system works. Portugal has a universal healthcare, which is public healthcare, and private healthcare. The public healthcare is available to all citizens and legal residents and is funded from taxes. Private healthcare is also available. It's a bit more pricey than the public one, as pretty much everywhere in the world. However, the quality of Portuguese healthcare is on another level. It is really good. The facilities are very new. If we're talking about, let's say, private hospitals, the service, the people, it's amazing. I've been both to private and public hospitals and I have something to tell you. But first, let's dive into who can get the coverage for, let's say, public health care. Well, pretty much anyone with a legal status. This means if you have a valid residence permit, for example, you came here to study, you came here to work, you moved here to retire, you have a residence permit, and you will be covered by Portuguese healthcare. In addition, there are certain groups that are not legal residents, but they're still covered. For example, children under 18 who are visiting Portugal, pregnant women who are in Portugal for less than 90 days, and tourists from countries that has an agreement with Portugal. Even though the public healthcare is free, there might be some extra fees associated with certain treatments and services. For example, there might be fees associated with hospital stays, with prescriptions, with some kind of tests. But those fees, they're not like super high, they're like pretty affordable for everyone. An important thing to know that you're not automatically covered once you move to Portugal. You need to register for both public and private healthcare. First, you will need to get a card that's called Carta de Utente, which is basically a health card, health number that you will need when you're gonna go to a hospital. But first, you need to get your NIF, which is your taxpayer number. Once you get your NIF, you take your NIF, your passport, your proof of accommodation, so let's say your contract, and you go to Centro de Saúde. This is basically like a medical center, I guess, where you take all this stuff and ask for your Utente number. Once you get your number, you can book appointments with doctors both in public and private hospitals. It is important to note that you might need to get your family doctor first, similar to Canada, similar to States, before booking things. However, if you go to a private hospital, you might not need a family doctor. Yep. And speaking of private hospitals, you basically need the whole same thing. You get your Utente number or SNS number, then you go to a hospital, fill in some papers, you're good to go. As I've mentioned before, I've been both to public and private hospitals here in Lisbon and Portugal, and I mean, they both are amazing in terms of wait times. Of course, some of the doctors might be harder to book. For example, my friend booked an appointment with gastroenterologist in like January for April because, I don't know, apparently people eat a lot of fatty foods, drink lots of beers, so they all have like digestion problems. But generally, for example, in private hospitals, I can book my appointments for the next day. I recently developed an allergy or like asthma. I booked my appointment with an immunologist the next day. Like, no waiting, no nothing. Speaking of booking, you can do everything online. Each hospital has its own application where you can go and book your appointments, your consultations, your exams. But similar for public healthcare, you can go to the website SNS24 and book everything you need there. You can also call if you prefer to, but I mean, you have a website, you have an application, just go and book everything. A very important thing to know about public hospitals that the wait times, even for general appointments, might take some time. So when we moved to Portugal, we wanted to exchange our driver's licenses. And in order to do that, you will need a health certificate, like a typical whatever she can see, she can hear, whatever she can drive. So we went to a public hospital in September. We were like, we need to get that paper. She's like, yeah, I'm gonna schedule an appointment, blah, blah, blah. December 24th. Feliz Natal, Merry Christmas. I'm like what is happening? It's September. She's like, well, that's the earliest I can give you. We literally found a private doctor who did everything this same day. We paid like, I don't know, 30 euros. Were this 30 euros worth it? Absolutely, because waiting for 3 months to get one piece of paper that literally says she can drive, even though I had my license for 12, 13 years. Like, thank you, but no. And another interesting story about waiting times. Oh, my Canadian and American friends will love it. So my husband had to go to the ER. It took him 1 hour in and out. That's it. C'est ça. So he spent 30 minutes waiting for the doctor to see him, and then 30 minutes doing exams and like x-rays. In Canada, if you are in the ER, like you can wait for, I don't know, 24 hours. Like I know a person who waited for literally a whole day with a broken arm because they were like, well, you're not dying. Here's some Tylenol, like ibuprofen. They're like, come tomorrow. Tomorrow by like 10 a.m. you'll get in. And he was like, thank you. And on top of that, my husband paid 40 euros for his entire visit. Perfect. A fun fact about Portuguese healthcare system. Portugal has a very developed teleconsultation system, which basically allows you to have your consultations from anywhere you want. This is especially helpful if you live somewhere like in a smaller city, in a village, or even like in the field. You can book your consultations online, remotely. Of course, if you go in to see a doctor because you have like, I don't know, some kind of a rash, maybe it would be better to go see a doctor in person because they'll need to see you. But if it's a follow-up consultation, if it's something that doesn't require you to be physically there, you can just book a video consultation, that's it. To be honest with you, I don't think I've seen some of my doctors in real life ever. We just talk on Zoom, that's it. As I've said before, sometimes you don't even need a family doctor to book your appointments. And this is amazing. You don't need to go through all these doctors just to get to the one you need. So I had a knee injury many years ago, and I know there's something wrong with it because when I walk it clicks, so it's like I need to see the knee doctor. Instead of going to a family doctor, asking for a referral, and then going to a knee doctor, I literally just went to my app, searched for the doctor I needed, booked an appointment, that's it. This is amazing because the whole Canadian thing with like going through a family doctor, it drives me nuts. Like, I know what I need. Well, not in all of the cases, but sometimes, or like in most of the cases, I know that like I'm sneezing, I need to see an allergy doctor. I have a knee problem, I need to see the knee doctor. So this is amazing. I'm not sure you can do that in a public hospital, but in a private one, for sure you can do that. As for the prescriptions, you will need to see your family doctor because, well, who else is gonna do it for you? But if, let's say, you're coming from Canada and you have certain types of medications that you used to take, you can just come to the doctor and say, hey, I've been taking this in Canada, it worked for me. Even if your prescription is expired or you don't have it, just talk to the doctor, ask, and they will most likely prescribe it to you. I have cold sores like many times a year. I just went to my doctor, I said, hey, that's what I was taking, it was working, here's the amount, dosage, whatever. She's like, okay, sure, I'll give you the same thingy here in Portugal. So whenever you have a cold sore, you go to the pharmacy, you get yourself the medicine, and you're good to go. Ooh, another fun fact for you. Did you know that you can go to different family doctors? Ooh, sounds so surrealistic for Canada. So basically, if you prefer to go to a private hospital, you literally book whoever is available. You don't need to wait for your family doctor when they have a slot. You literally check who has the nearest appointment. You book it, you go. They have everything in the system, so when you go to 10 different doctors, they will have all the same information that is in the system. And let's talk about the coverage. What is actually covered? So public healthcare in Portugal provides a wide range of things that are actually covered. For example, different kinds of consultations, tests, x-rays, hospitalization, surgeries, maternity, paternity, mental health, pretty much everything, I would say. But again, not everything is free. As I've mentioned before, you might need to pay for certain things. But again, it's public healthcare. It's not gonna be like thousands and thousands. As for the private healthcare coverage, you will need an insurance. Similar to other countries, you have a variety of different plans available. My husband and I pay around, I think, 120 euros per month, which is 60 per person. And I think we have like a maximum plan. You can get an insurance plan for like as low as like 30-40 euros per month, which is amazing. The coverage we have is pretty good. I think we covered for 1 million euros for oncology. Most of the consultations cost 15 euros fixed price, so it doesn't matter if they charge us 100 or like 80 or like 70, we pay 15. But it pretty much depends on your plan and what's covered. As for the prices in private hospitals, they're just amazing. Here's what I paid when I went there. First of all, consultations are 15 euros fixed with my insurance plan. Blood tests, 38 euros. ECG, euro 50. When they gave me the invoice and I saw 1 euro 50 cents, I was like, what is this? This is just amazing. Pap smear is 20 euros, mammogram is like 15 euros. Everything is pretty much, you know, in a 100 euro range. I haven't been to a few doctors yet, ophthalmologist and dentist, but if you guys are interested, when I go, I'm gonna make a separate post or video because I have the dentist appointment scheduled next month. And speaking of service in Portuguese hospitals, my experience has been positive. A lot of doctors in public sector, they speak English, but please don't assume that they will all speak English. When I go to my Centro de Saúde, there are 2 nurses, 2 doctors that speak English. The rest, I have to use my Portuguese, which is not that great, but I can still talk to people, to the security guy, being like, hey, I'm here for this appointment, to the secretary or like the reception lady. But in a private hospital, everybody speaks English, I would say. Also, you can always check on the application on the website. There's a section that says, hey, this doctor speaks English, Spanish, Italian, Portuguese, and you can find a doctor that speaks your language or at least English. Overall, I should say that Portugal has amazing healthcare. I really enjoy going to the hospitals, even though I'm not a fan of doctors. I think I have a post-USSR trauma when I go to a hospital, and they're just, no, not the best experience. I don't like those. Here, I really look forward every time I go to the hospital because everyone is so nice. They try to help you. They do everything professionally, super fast, super efficient. Like, I'm starting to like hospitals, you know? And I think this is it for today. I hope you liked this video. If so, it was helpful for you. If you move into Portugal, don't forget to subscribe to this channel, like this video, and I'll see you guys next week. Bye!